So for this video, I'm going to be going over a pretty basic TMJ evaluation. I'll be presenting how I would do palpation, checking for range of motion, and then presenting the exercises in the 6x6 Kazi-Bato program, I believe is the name. So for palpation, starting on the outside of the face, I can check for the temporalis muscles, just feeling for that temple. And then if I want to confirm I want it, I can have the patient clench their jaw, and then I can feel that tension coming up. Moving down to the mandibular angle, about through this way should be where the masseter muscle is. So if I just start feeling around for those muscles, and then if I want to confirm I'm on it, have the patient clench their jaw, I can feel that tension popping up. For the lateral medial pterygoids, I'm going to ask the patient to open up their mouth, and then if I go in, moving to the back of the mouth, if I feel that lateral band of tension right there, I know I'm on the lateral pterygoid. And if I move medially with that, I should be on the medial pterygoid. There's the lateral pterygoid, there's the medial pterygoid. So that's palpation for the TMJ joint. Now moving on to active range of motion. For jaw opening, which, if we recall, first 10 millimeters is a rotation on the TMJ joint, followed by the remaining 20 to 40 millimeters being an anterior slide. So if I can have the patient open up their mouth as wide as they can, and then close it. So with that, I'd be checking for any lateral deviations that indicate any kind of TMJ dysfunction. And the way to measure it, if you open the mouth again, I would use like a ruler, and I could do lip-to-lip measuring, or I like between the front teeth of each, and then measure the distance that way. And then for lateral deviation, can you move your bottom jaw to the left? Same idea, I would go ahead and move it to the left. I would measure from gap of the two bottom front teeth to the right, and that should be about 10 millimeters each side. Go ahead and do it to the left, and I'd be assessing for any pain, asymmetries, or the like. And then for protrusion, I'm just going to ask the patient to move his jaw forward, and then again measuring that angle between the bottom and the top. And then for retrusion, I'm just going to ask him to move his jaw back, checking for any pain or any weakness or just any signs that the patient was talking about. So that's how I would do range of motion for the TMJ joint. For the active, for the 6x6 program, the first thing I would do is just teach the patient the resting open pack position of the TMJ. So put your tongue on the tip of your mouth and keep your jaw slightly apart. Try it if you're trying to make a cluck sound. So yes, so that's the first exercise, is the cluck position, essentially is what we call it. So this next one, it's going to be some controlled TMJ opening. So what I want the patient to do is, while you keep the tongue on the roof of your mouth, I want you to open your jaw up and down. And that would be the normal range of TMJ opening and closing. Next exercise I would do is some upper cervical traction. So put your hands behind your bed and try to feel the bony bump just underneath your skull. And then pull your head up to give yourself some upper cervical traction. Okay, go ahead and relax. And then for the next one, what we would do is basically some resisted movements. So if I put my hand underneath his jaw and ask him to open, and be going up against resistance. If I'm trying to get him to open, if I want him to close, we would do some lateral deviation, push into my hand, and then the other way. Just working those different ranges of motion for the TMJ joint. Next one I would do is some deep neck flexors, so just stand up nice and tall, make that double chin, bring it back up and down, up and down. Okay. And the reason I'm doing that is because with the TMJ dysfunction, it might be due to upper cross syndrome. So I'm trying to correct those weak deep neck flexors. Another way to do it is some scap squeezes. Just bring those shoulder blades together, and that would help with the tightness in the pec minor if it was a posture-related TMJ dysfunction. And that's how I would do a pretty basic TMJ eval.